Welcome back. Let's bring you some more stories. And the Ghana Health Service has expressed concern about the increasing number of COVID cases among children. 20.8% of those infected globally are children. 13 schools have recorded cases, with 2 of them closed down. Let's go on phone now and speak with Professor Fred Binka. He's an epidemiologist at the University of Health and Allied Sciences, and he joins us. Many thanks for your time, Prof. Now, we're seeing COVID-19 in kids, but initially this wasn't the case. Hello, Prof. Can you hear me? Hello, Prof. Can you hear me?
Yeah, I can hear you. Can you hear me?
Yes, I can hear you now. I was saying that initially during the height of the COVID-19 pandemic, or in the beginning of the COVID-19 pandemic, there were pretty much non-existent COVID-19 infections in kids. But now we're seeing a rise in COVID-19 infection among children. What might be accounting for this?
No, I don't think that was the situation. The children have never had protection against the COVID-19. And the COVID-19 was always diagnosed after a test. And if you remember, most of our tests were whom we know were getting ill, and some of them were dying. We were not testing the children. So it's now we began to start the testing the children, and then we're seeing the numbers. But it's not because something has just happened.
So now that we're seeing much more infections, some schools are closing down. What would you suggest to be done? Should we close down the schools to ensure that we don't spread it? What do we do?
No, so there are a couple of things that we need to do. First of all, remember that keeping schools open is critical, so important. Keeping schools open is extremely important. First, for educational needs, they are taught and they build up, but also for social and mental development of the children, you need schools to be open. And thirdly, you want to reduce inequalities. So keeping schools open is the last. Closing schools is the last option. At the moment, we are lucky. We have so many tests that are available and they are cheap. There's no reason why we cannot screen the children as they go to school and screen them from time to time. And schools which have a very high level of infection, then we close those schools. But it's not advisable to have all schools closed down because there are a couple of cases among school children. I think that the science does not support that.
Okay. Now, Prof, we're not even done with COVID-19 yet, but we have another issue, that is the monkeypox. What might we be doing wrong?
No, we are not. In fact, what we're doing wrong was that our surveillance system was not strong enough. And in fact, yesterday you saw the money that was spent on COVID. We haven't invested in keeping our surveillance system strong enough. This is the problem. The surveillance system must be strong. We must have agents. We must have test kits that screen, and then we have the final diagnostic test. It's nothing are we doing so far which is wrong. It's just that when we test, we find them. And we have the capability to test, but we don't have the resources to do the test. So
I say that we should go back to, the surveillance, the testing regime?
The surveillance is an established way of providing healthcare all over the world. We cannot go back to start. You have to strengthen it. If our surveillance system is not working now, that is a big hole in our healthcare delivery system. Because unless we look for it, we will not find it. And by the time we find it, it has covered a bigger portion of the population, or we have an epidemic or a pandemic.
Now, it seems that we're seeing an increasing number of active cases. Going forward, beyond the social interventions that we do know, what more can we do to prevent a further wave?
So the issue is straightforward. We need to increase the percentage of our population that has been vaccinated. We are lucky there are vaccines available in country, and we must find all the means available. And this must be a complete, total country effort. The churches, the schools, the politicians, everybody must put his hands back on deck, because if this thing comes back, you know what it will do to the economy. So we can't pay lip service to it. We have the vaccines. Let's organize. This is how we did the tree planting recently. I saw the movement to plant trees. Why can't we move to vaccinate our people so that they can be protected?
But Prof, there seems to be some level of vaccine hesitancy. What more can we do to show to people that indeed the vaccines are safe? Because still there are some individuals who think that the vaccines are not safe.
That is a very small point. I tell you, we have vaccinated so far close to 15 million Ghanaians. Can the press show us who have died from the vaccine or who have had any adverse events? You see, those days it was a story. People were going on the social media. But today, over 15 million Ghanaians have had the vaccine. So please, let's confront them with the information. 15 million. By now, we should have had people dying on the streets from the vaccines that they're taking. So we have concrete evidence now, and we must not allow those people who are peddling this information to take over. If they do, well, it will come back. If it comes back, they will suffer.